In today's video, I'm going to be talking about hypertension, what hypertension is, and the various stages of hypertension, and why you should know these stages of hypertension. What are other ways of categorizing hypertension? What are the various factors or risk factors of hypertension, and how you can participate in the management of your diagnosed hypertension? Hi, I'm Dr. Francisca Osage, and thank you for joining me on Francisca on Health Matters. Now, high blood pressure, otherwise called hypertension, is a sustained blood pressure of or above 130/80 millimeters of mercury. Now, it is important to recognize that the heart beats in what is called a cardiac cycle, which consists two phases. There's the contraction phase and the relaxation phase. During the contraction phase, the heart muscles pump out blood onto the arterial circulation. And during the relaxation phase, the heart muscles relax. During the contraction phase, there is blood expansion within the arterial system as a result of the blood received from the heart. And the pressure within the arterial system, when measured, is called the systolic blood pressure. In other words, it's the pressure during the contraction phase of the heart. Likewise, diastolic pressure is the pressure within the arterial system during the relaxation phase of the heart cycle or the cardiac cycle. It's also important to recognize that there are stages of hypertension, and if you are newly diagnosed as hypertensive, the kind of management that's going to be given to you will depend on the stage in which your numbers fall into. And so we have a stage of elevated blood pressure. In this stage, the systolic ranges from 120 to 129 millimeters of mercury, and the diastolic is less than 80. Then there's the stage 1 hypertension. Stage 1 hypertension, the systolic range from 130 to 139 millimeters of mercury, and the diastolic ranges from 80 to 89 millimeters of mercury. And then we have stage 2. This is systolic of 140 and over and diastolic of 90 and over. Another concept of importance is what is called a hypertensive crisis. In a hypertensive crisis, the blood pressure suddenly elevates to levels of 180 or over for systolic blood pressure and 120 or over for diastolic blood pressure. It is highly critical that you avail yourself to the nearest healthcare facility in order that the blood pressure is cautiously reduced. There might be symptoms that follow this condition, such as drowsiness or confusion, breathlessness, chest pain. In these situations, they could describe a condition called hypertensive urgency, whereby there is an observed elevation of blood pressure, but there's no damage to organ. On the other hand, there is the hypertensive emergency, whereby the blood pressure elevation is accompanied by end organ damage. So in either conditions or both conditions, it is necessary to avail yourself as soon as possible to the nearest healthcare facility. Now, for these various stages, management is highly centered on lifestyle adjustments, especially in cases of elevated blood pressure and the early stages of hypertension. Now, with the use of antihypertensives and the choice for antihypertensives, this is at the discretion of the healthcare provider. Now, I mention this because I've heard of cases whereby friends known to be hypertensives engage in practices such as sharing of their medications, and this could be highly detrimental, especially because when it comes to the choice for medications, there are certain factors that are put into consideration, such as the presence of comorbidities such as diabetes, heart problems, kidney problems, even factors such as race. And it could be highly detrimental if one person takes a medication that is contraindicated for their use, especially because of the various side effects that are known to occur with the use of certain medications. So this is something that we should pay attention to and be very mindful of. Being very intentional is key to management of hypertension. Now, the management of hypertension starts from even before you get diagnosed with hypertension, as one of the very key important factors for hypertension in terms of the risk factors is age. The older you get, the more prone to becoming hypertensive you'll be, especially when there's a family history of hypertension in a parent or sibling. This is where lifestyle adjustment becomes very crucial. We want to engage in habits that will reduce the risk of having hypertension, especially because once diagnosed with hypertension, the management becomes for life. We all dread the complications of heart diseases and stroke. That's important to note that hypertension is not the only cause for heart disease and stroke, but it is high up there in terms of the numbers. Now, there are other complications such as there's damage to the kidney, lung congestion, especially if there's problems with the heart, as in heart failure. There could be problems with erectile dysfunction, problems with vision. Now, these conditions, especially if due to high blood pressure, could be as a result of either untreated high blood pressure or poorly managed high blood pressure. Now, if you're diagnosed with and you're receiving treatment for high blood pressure, you have to be very intentional to avoid these complications. Now, at early stages of high blood pressure or hypertension, you will most likely not encounter any symptoms. Now, once in a while, there might be experiences of headaches, but typically it is asymptomatic. And diagnosis of hypertension is usually during a scheduled or routine visit, such as the annual visit or biannual visit, or a visit for a different problem. So this emphasizes the need to regularly avail yourself to routine visits and checkups. So this brings me to another way we categorize hypertension based on the causes. Now, based on causes, there's what we call secondary hypertension. This is hypertension as a result of a known medical condition that has prompted our visit to the healthcare facility. Now, like primary hypertension or essential hypertension, in which the root cause is unidentified, the causes for secondary hypertension can be identified and indeed managed. Common causes of secondary hypertension will include conditions such as pregnancy, sleep apnea. There are certain medications or drugs that are known to cause hypertension, such as amphetamines, even alcohol. And then there are conditions involving hormonal dysregulation that can cause hypertension, such as hyperthyroidism, Cushing's syndrome. Now, next, I would like to talk on that aspect of management regarding controlling your blood pressure in which you can participate in. Before that, let's look at a list of risk factors that could predispose to hypertension. Now, we talk about age. The older you get, the more likely prone to high blood pressure you will get. Now, this you can control. There's also family history. There's the genetic play. That also you can control. There's smoking, overweight or obesity. There's lack of physical exercise, too much alcohol, high salt intake. Now, the management of hypertension is indeed a teamwork, which involves the healthcare team in addition to you. Yes, your input highly determines the outcome of the management. And being aware of these risk factors is highly crucial. But also important is the lifestyle adjustments, which are intentional. So we start off with the diet. There's the need to be intentional about our diets. There's what we call the DASH diets, which focuses on vegetables, fruits, whole grains, in addition to having fat-free diets and low-fat dairy products, having poultry, fish, beans, and nuts. In general, there's the emphasis on foods that are rich in potassium, calcium, protein, and fiber, and low in saturated fats and salts. Regarding salts, most times the problem is not the amount of salt we put in our diets. However, it is those processed items from our grocery store. And so there's a need to pay attention to the labels of these food items. It will be advisable to seek the products with the least amount of sodium when it comes to the choice of the various items we pick during our purchases. Now, smoking tobacco is another habit, and the problem with this is the addictive effect of nicotine. The problem does not form in one day, but it starts from day one, so avoid smoking at all costs. And the same goes with alcohol. Another important routine is that of exercise. Now, this is something we have to be very intentional about, especially because these days we're very consumed with activities, both home and out of home. And if we're not careful, we do not have time to engage in exercise activities. Now, we have various exercises. Most encouraged is moderate intensity exercises such as walking, jogging, swimming, or there could be also stretch exercises or resistance exercises such as squats. And these are very helpful and will go a long way in the management of high blood pressure. And finally, never neglect your scheduled appointments with your healthcare provider, as during these appointments, there are certain parameters that are monitored, and this will pretty much determine if the current management is going to be continued, or there might be the need to make adjustments to the management. And this will pretty much help you to stay abreast when it comes to the management and control of your blood pressure. Again, I hope you found this informative and educative. And if you've had, please subscribe, and I'll see you in the next one.